name. I chose the molecule for albuterol, a medication that we give in the ICU frequently. Here is the molecular formula. Here is our molecule drawn out without any of the chirality yet. And then here is our IUPAC name. We got 4,2-tert-butyl-amino, 1-hydroxyethyl, 2-hydroxymethyl-phenyl. Phenyl is our parent group. This right here is our phenyl, including this little OH. You see how it is a cyclohexene, but it has 3 pi bonds. This makes it an amino ring plus our OH group on it, which makes it a phenyl. So see how this says number 4. We're going to start here 1, 2, 3, 4. This is the 4 spot, showing that on number 1 we have our hydroxyethyl. And then on number 2 carbon, we have an amine group attached. This is a secondary amine, which is attached to a tert-butyl. We've got 3 methyl groups right there. And then for right here, on carbon number 2 on the parent chain, we have our hydroxymethyl group. So our functional groups, we have alcohol, we have another alcohol on an ethyl chain, we have our amine, secondary amine, we have a tert-butyl, and this is what the molecule looks like without chirality. Now our chiral center is going to be our only sp3 that has 4 separate substituents. So this is all sp2 carbons. This is a sp3, but it does not have 4 distinct substituents. So this right here is our only chiral center. Now the interesting fact about albuterol is in the ICU setting, we actually give it as a racemic solution. So we have 50% of the 2 enantiomers that consist of albuterol. So there is R-albuterol and then there's S-albuterol. As far as other isomers for this molecule, there theoretically can be constitutional isomers. However, we do not use any of those in the medical setting. And then since it only has 1 chiral center, it does not have any diastomers. In this picture, you can see that this is our R-albuterol, or in medication name, it is our levoalbuterol. So albuterol in the racemic state is a beta adrenergic. So it causes bronchodilation on the beta receptors in the lungs. However, it can also cause sympathetic response to, which increases heart rate as well. So, but our R-albuterol is actually our more just bronchodilatory enantiomer, and it causes less of the tachycardias that the S-albuterol does. So if a patient has a high heart rate or they have lots of ectopy, we will actually just give one of the enantiomers without like the racemic mixture. We'll just give the levoalbuterol. Unfortunately, though, the levoalbuterol does not have the same effect as the racemic because it is missing out on some of the smooth muscle relaxation that the S-albuterol has. So here is our IUPAC name for this enantiomer. And you see right here it says 1R. So this is our R chirality. So you see the OH right here, it's going clockwise, so it is R chirality. Okay, and right here we have our S-albuterol. Our S-albuterol is actually more of the inactive enantiomer of this molecule. You see how the OH is in the back, so now we're going counterclockwise, and that's what makes it our S-albuterol. So both of them have a purpose in the racemic mixture that we give for, quote, albuterol in the ICU, but this one does have more of that beta adrenergic effect on this sympathetic nervous system, so it does cause tachyarrhythmias. We give them both together, and it was interesting that we do separate them if we do have those problems with arrhythmias.